I've had a really fantastic time at Bond. I think what makes Bond so special is probably the small class sizes. You get to really know your classmates, and while that sounds a little bit cheesy if you haven't experienced it, when you get out on clinical placements you really have a Bond family and a support structure there. I think it's good to be able to debrief after you've missed a cannula in 5 goes and done your first resus and get really excited with other people who have just delivered their first baby. Those sorts of things are really special to be able to share with people who understand it, and they also get you through the really stressful, tough times that being a med student has lots of. A highlight for me at Bond has probably been delivering my first baby. It was a young lady who was not very much older than myself, and she was delivering twins. It was a 16-hour labour, and I think I was exhausted as what she was at the end of the time, although she probably doesn't agree. I had sore stomach muscles the next day from contracting my own pelvic floor with her. But it was a really rewarding experience and something that's really sparked my interest in perhaps going into obstetrics and gynecology. My first experience of doing resus was in the emergency department. An elderly gentleman was brought in after having a heart attack out of hospital. We had to do full resus, including chest compressions and putting a tube down his throat to help him breathe, and it was a little bit unsure whether he would actually make it. The next day I returned to do my ED shift, and the doctor said to me, "Oh, why don't you go up to ICU and see how our patient was going from the day before?" I went up and I was absolutely gobsmacked to see him tube out of his mouth, sitting up, eating his lunch, talking to me, not remembering a thing, but being absolutely stoked to be alive. So that was a really rewarding experience and something that I'll never forget. After 2.5 years at Bond, when you're finished with all your lectures and tutorials and endless days of PBL, we go on to do clinical rotations. So you start off with what they call an integrated clinical semester, and that's a semester where you're between Bond and the hospitals, and they give you a little bit of an introduction as to what to expect when you get out there and are really living it day to day. After that, you go on to do a year of general rotations, and they cover the main medical areas. That includes general medicine, general surgery, women's health, paediatrics, mental health, and some people get to have a rotation in imaging as well. That really gives you the foundation for setting you up, and then in final year you go on to do a critical care rotation, an emergency rotation, and a general practice rotation. As a med student, I guess your jobs from day to day can vary from being very mundane paperwork, having to write in the clinical notes, to getting to do some really exciting stuff. Normally your day starts with whatever team you're associated with. You would go on ward round with them. So that normally means arriving at hospital at about 7:30 in the morning, going through the patient's notes and finding out what's happened overnight and looking at their blood results that have been done before you arrived. And then the rest of the team gets together along with the physios, the social workers, perhaps the speech pathology, and you do a general ward round to see how your patients are and to plan what you're going to do for the next couple of days for them. After that, you tend to either go to outpatients clinics where you'll see people coming in from the community, or you might get to go off to surgery. Often as a med student you get to scrub in surgery. That can be quite nerve-wracking, making sure that every tiny little bit of your fingers is scrubbed clean before you start. But once you get in there, it's really exciting. You'll often get to perhaps hold the sucker or be the one that has to stand for hours on end with your arm in the same place to hold things out of the way. But you get to see some really exciting things, particularly when you do your surgery rotation. You come in of an evening if there's on-call emergencies, and often because there's less staff at that time, you can actually be really useful. I can remember getting to help hold the laparoscopic camera to do an appendicectomy, and I ended up being able to help tie and take out the appendix at the end of the surgery, so that was really exciting. Bond prepares you really well for going out to do your clinical work. Right from the very beginning of the program, we have sessions of an afternoon at uni where we work with standardised patients, so actors that are trained to play particular conditions. And we start off learning basic communication skills, how to build rapport, how to take a proper history from patients, and how to summarise that together back to a supervising doctor. As you progress and you understand more about the medical side of things, we learn to take histories that are a bit more specific to the different medical areas, like a cardiovascular history or a respiratory history. And then we also start to have training with the different GPs, and they come in of an afternoon and we go through our physical exams with them. We do it in small groups, and again we have standardised patients. So this really gives you an opportunity to have someone who's an expert watch you perform the exams and to learn how to do things properly rather than just having to read it from a textbook. And I think what's special about Bond is that we have that small group, so there's really only 4 or 5 of us in that teaching scenario. We all get personal attention, so to speak, and you can really make sure that you're doing things right. We also are trained in the different special communication areas, so how to break bad news to a patient, how to be assertive if a situation's not going right, how to help a person who's smoking quit smoking, and those special counselling skills. And I think that that's something that sets Bond apart. We're really taught those things well from the very beginning, and going into the clinical setting is not so daunting when you talk to patients because you've been taught that really well from the beginning. The biggest challenge I think about being a med student at Bond is that you just have to really keep on top of the work. So that means is sort of a constant roll-on of needing to study, to do your assignments and to keep up with things. And as you get into your clinical years, your days at the hospital are long, and then you need to do that work on top of it afterwards, and it can become quite draining and you get quite fatigued. So I think that keeping a balance with having an outside life, doing some sport, having a little bit of a relaxation can become a real challenge, but it's something that's really important to do so that you stay sane as you study and are able to give the best that you can to your medical degree. While we're on clinical rotations, we're assessed in a slightly different way to when you're doing exams and assignments on campus. Each rotation you normally have to write a number of case reports on patients that you've seen in the hospital. So this involves you sitting down with the patient personally and going through the history step by step and really in depth. And then you also perform the physical examination yourself and document your findings. And then you track that patient through their stay in the hospital, what investigations are done, what diagnostic decisions do they have to make, and then you need to explain what you've learnt from that case and how it all fits together. Often there's one written version of this, and often one oral presentation to one of the clinicians that are looking after you. It's a really good experience because a couple of those patients you get to know really in depth, and you have a good understanding of what's going on with them, and that helps with your knowledge more broadly. As you go through, we also write a number of personal reflections on situations that we've experienced in the hospital. This can include things like a critical incident analysis, so if something's gone wrong with the administration of a drug or you've seen something that didn't quite sit correctly with you ethically, and we work through those things in our reflections and also are able to talk to the faculty so that we have a better understanding of what's gone on, and that helps our personal and professional development.